Hi friends, today we are going to discuss one of the most important topic in cardiology is cardiac cycle. Okay, so before going to start this cardiac cycle, I just want to recollect our basic information about blood circulation in our body. And here we know the heart consists of four chambers. Upper two chambers are called atrium or auricles, and the lower two chambers are called ventricles. We know we have oxygenated and deoxygenated blood, and has the deoxygenated blood which is collected from lower part of the body by what inferior vena cava, and upper part of the body by superior vena cava will open directly into the right atrium. So the right atrium contains deoxygenated blood which is collected from inferior and superior vena cava. Okay, from the right atrium the deoxygenated blood is pumped into the left ventricle. From right atrium it is pumped into the right ventricle. From right atrium to the right ventricle. Okay, the wall present in between the right atrium and right ventricle is called tricuspid valve. What is it? It is called tricuspid valve. Okay, from right atrium the deoxygenated blood enters into right ventricle. From the right ventricle this deoxygenated blood enters into the lungs on each side, right and left lung, through pulmonary artery. This pulmonary artery arises from the right ventricle, from the trunk of the right ventricle, and splits into right and left pulmonary artery and to supply to each of the lung. From the lungs the deoxygenated blood is oxygenated, and from the lungs the oxygenated blood and from the lungs the oxygenated blood will enter into the left atrium. See, this is the left atrium through pulmonary veins. These are four pulmonary veins, two from each lung will join and release the oxygenated blood into the left atrium. So once the oxygenated blood is released into the left atrium, the blood is pumped into the left ventricle by opening of the valve called mitral valve. See here, mitral valve is present in between left atrium and left ventricle. Once the oxygenated blood is pushed from left atrium to the left ventricle, the oxygenated blood from the left ventricle will go into the aorta. See, ventricle will go into the aorta. See, this is the aorta. From the aorta it is applied to the whole body. It's applied to the whole body. Understand? See, this is the right ventricle which receives deoxygenated blood from the right atrium. It gives a pulmonary artery. See, this is the pulmonary artery. This pulmonary artery again splits into right pulmonary and left pulmonary artery and supplies to the lungs, where in the lungs the deoxygenated blood is oxygenated, and once the oxygenated blood is again supplied to the left atrium of the heart through pulmonary veins, which are four in number. Two pulmonary veins from each lung will open into the left atrium where oxygenated blood is collected. Once it is collected here, it pushes the mitral valve and opens into the left ventricle. From the left ventricle, this oxygenated blood will open into the aorta. From the aorta it is applied to whole parts of the body. This is the basics of the what circulation. Right now we'll go into the depth of the cardiac cycle step by step. See, what is the definition of cardiac cycle? The cardiac events that occur from the beginning of one heartbeat to the beginning of the next are called the cardiac cycle. Understand? That is one heartbeat, that is lapped up, again lapped up. So the events that are occurring from the beginning of one heartbeat to the beginning of the next heartbeat is called as cardiac cycle. Okay, so how this cardiac cycle is occurring is by the initiation of by spontaneous generation of an action potential in the sinus node. We know we have nodes present in the heart. One is SA node and another one is AV node, atrioventricular node, and sinoarticular node, which is also called sinus node. Where is this node located? It is located in the superior lateral wall of the right atrium, superior lateral wall of the right atrium near the opening of superior vena cava, and action potential from there travels rapidly through both atria and then through the AV bundle into the ventricles. Okay, this we know. Once the impulse which is generated in the sinus node, okay, SA node, the impulse is transmitted to the AV node. From the AV node it is transmitted to the both ventricles. Okay, from here the cardiac cycle, okay, begins. Okay, because of the special arrangement of conducting system from atria into ventricles, there is a delay of more than 0.1 second during the passage of cardiac impulse from atria into the ventricles. So why this special arrangement of conduction system is present? Here we need to understand that atrial contraction is accompanied by ventricular relaxation. Understand what does it mean? Whenever atria is contracting, the blood in the atria are pumped into the ventricles, because at the time ventricles are in relaxed phase, they are ready to receive the blood. I mean ventricles are in normal phase. Okay, so to occur this, we need a delay in the action potential, okay, from atria to ventricle to pass. Okay, so for this delay to occur, here the sinus SA node, from SA node to pass, to travel the potential to the AV node and to the ventricles, there is some length. So to pass this length, here it takes more than 0.1 second during passage of the cardiac impulse from the atria into ventricles. So this delay is helpful for pumping of blood from atria into ventricles. Understand? Otherwise, if there is no delay like this impulse, both the atria and ventricle will be in either relaxation or in contraction. So at the time there will be no pumping or receiving of the blood. Got it? Okay. So here this delay allows the atria to contract ahead of ventricular contraction, thereby pumping blood into the ventricles before the ventricular contraction begins. Thus atria act as a primer pump. So what is it called? Here atria act as a primer pump because who is receiving the impulse first is atria. Once the impulse is received in the atria, atria will contract and it will push the blood into the ventricles, because ventricles are in a relaxed phase which are ready to receive the blood. So which is pumping first here blood, that is atria. So atria act as a primer of the pump. So what is the, how much is the delay here? It is more than 0.1 second. Okay, so this more than 0.1 second delay in impulse helps in atria to act as a pumping of blood into the ventricles. Understand? Okay, you understood the physiology right here, why this delay occurred. Okay, next go into the diastole and systole. The total duration of cardiac cycle, including the systole and diastole, is a reciprocal of heart rate. Okay, for example, if the heart is 72 beats per minute, the duration of cardiac cycle is 1 per 72 minute per beat, about 0.0139 minute per beat. It means per minute, we know if we count our heartbeat, it normally ranges up to 72 per minute. Okay, so 1 minute we have 60 seconds. But here for 60 seconds how many beats we are getting? 72 beats. So if you calculate 1 beat per second, how much time it is taking is 0.0139 per minute. Okay, it is taking 0.0139 minute per beat. Understand? Right. This one I have explained. Okay, now here there are 4 important phases of cardiac cycle. Okay, so first one, here you see the diagram. First phase is ventricular filling, the second phase is isovolumetric contraction, third phase is ventricular ejection, and fourth phase is isovolumetric relaxation. So this cycle continuously occurs for maintenance of effective cardiac output. So here you see the first phase, phase 1, period of filling. What is filling here? Ventricular filling. The first phase is ventricular filling. So what happens here? The moderately increased pressures that have developed in the atria during ventricular systole immediately push the atrioventricular valves open and allow blood to flow rapidly in the ventricles. This period is called the period of rapid filling of the ventricles. As we have seen previously that when the atrium contracts, that is when the atrium or in a systole, what happens? The AV valves open and the ventricles will receive the blood from the atria, and this rapid filling is called the period of filling of ventricles. Understand? Okay, first where the impulse is generated in the atria, right? So once the impulse is generated in the atria, what will happen? Atria will start to contract first, and once atria is going to contract, it will open the atrioventricular valves, and these ventricles will get rapidly filled with the blood. This first phase is called period of filling. Understand? Coming here, we need to understand one thing: end diastolic volume. As venous blood flows into the ventricle from the left atrium, the ventricular volume normally increases to about 120 ml, called the end diastolic volume, an increase of 70 ml. Okay, this one I will explain you later. Okay, next phase is phase 2. What is it called? Isovolumetric contraction. This is very important. You need to understand what is it. Phase 2, period of isovolumic or volumetric isometric contraction. See, immediately after ventricular contraction begins, see here what happens. In the phase 1, ventricles received the blood. Once the ventricles received blood, what will happen? Again, ventricles will start to contract. So immediately after ventricular contraction begins, the pressure in the ventricles rises abruptly, causing the AV valves to close. Why AV valves are closing here? See, blood is there in the ventricles. Now ventricles are going to squeeze. So when the ventricles are going to squeeze, again the blood should not go up into the atrium. So this is prevented by closing of the AV valves, which is tricuspid and mitral valve, right side and left side. So once the pressure builds up in the ventricles, first thing that happens is closure of the AV valves. So once the AV valves are closed, automatically the build-up pressure in the ventricles will lead to opening of the aortic valve. Okay, so here the blood enters into the aorta. See, immediately after ventricular contraction begins, the ventricular pressure rises abruptly, causing the AV valves to close. Then an additional 0.02 to 0.3 second is required for the ventricle to build up sufficient pressure to push the semilunar aortic or pulmonary valves open against the pressure in the aorta and pulmonary artery. Therefore, during this period, contraction is occurring in the ventricles, but no emptying occurs. So Here what is happening, additional 0.02 to 0.3 second is required for the ventricle to build up sufficient pressure. So here, once the pressure develops in the ventricle, what is it is doing? It is, first step is AV valves to close. Okay. So after that only the semilunar walls of aorta or pulmonary will open. Otherwise, if these close and this open at simultaneously, there will be some turbulence in the flow of blood. Understand? It won't occur like that. Okay. First, the pressure which is built up is sufficient to close off the AV walls, so that the back return of the blood will not occur into the atrium from the ventricles. Then, little pressure is required, around 0.02 to 0.03 second. Time is required to build some more pressure such that to push the semilunar aortic or pulmonary walls to open against the pressures in the aorta and pulmonary artery. Okay, so this time of 0.02 to 0.03 second is what there is no flow of blood either upward or downward, either into the aorta or pulmonary artery or into the atria, but only the contraction is occurring. So it is called isometric contraction or isovolumic contraction. Here what is happening, the volume of the blood is not changing, but only the contraction is occurring. So as there is no change in the volume of the blood, only the contraction is there. It is called as period of isovolumic contraction. Why it is called as explained, once the pressure develops in the ventricles, that pressure is required to shut the AV valves. Once the AV valves are shut, it takes some more time to develop some more pressure to open the semilunar walls of aorta or pulmonary artery. Okay, so this time which it takes to build up pressure, what is it? This time which it takes to build up pressure, the more pressure to open the semilunar walls of aorta and pulmonary artery. Okay, in this time there is no flow of blood either into the atrium or into the ventricle. Blood is stayed in the ventricles, but only contraction is occurring, okay, to build up more pressure. So this phase is called isovolumic or isometric contraction. Okay, meaning that cardiac muscle tension is increasing, but little or no shortening of the muscle fibers is occurring, and no flow of blood is there. Okay, now coming to the period of phase 3, this is called a period of ejection. What is it? Period of ejection. See, the phase 3 is ventricular ejection. Okay, the left ventricular pressure rises slightly above 80 mm Hg. The right ventricular pressure rises slightly above 8 mm Hg. The ventricular pressures push the semilunar walls open. Immediately blood is ejected out of the ventricles into the aorta or pulmonary artery. So in the phase 3, what happens? Whenever the left ventricular pressure rises slightly above 80 mm, the right ventricular pressure rises slightly above 8 mm of Hg, the ventricular pressure they will push the semilunar walls. So what are semilunar walls? The walls protecting left ventricle and aorta, and also right ventricle, the pulmonary artery. Okay, these walls will open and the blood from the both ventricles, the left ventricle rushes into the aorta, and from the right ventricle it rushes into the pulmonary artery. Okay, so this is called ejection of the ventricles. So this phase is called period of ejection, which is phase 3. Okay, approximately 60% of the blood in the ventricles at the end of the diastole is ejected during the systole, but 70% of this portion flows out during the first third of ejection period, the remaining 30% emptying during the second two thirds. Therefore, the first third is called the period of rapid ejection, and the last is called third is called period of slow ejection. Okay. So what is here again this period of ejections you are doing to rapid ejection and slow ejection? So it's very simple to understand. See, approximately 60% of the blood, how much? 60% of the blood where in the ventricles at the end of the diastole is ejected during the systole. Okay. So during the systole, what is happening? 60% of the blood is ejected. Okay. About 70% of this portion flows out during the first third of the ejection period, with the remaining 30% emptied during the next two third. What is it? With the remaining 30% emptying during the next two third. Then the first third is called rapid period of ejection. The last two third is called period of slow ejection. Okay. The first part of ventricular contraction, 70% of the blood is pushed, and in the next two third, okay, 30% is ejected, and this is called slow ejection. And in the first third of ejection period is called rapid ejection, because 70% of the blood is ejected from the ventricle. Okay, so it is called rapid ejection. Next phase is isovolumic relaxation. What is it? Isovolumic relaxation, also called phase 4. At the end of the systole, ventricle relaxation begins suddenly, allowing both the right and left interventricular pressure to decrease rapidly. So once the blood is pumped out of the ventricles, what will happen? Now the ventricles will begin to relax. Okay, because they have to relax to receive again blood from the atria. Okay, so allowing both the right and left interventricular pressure to decrease rapidly. Okay, once the ventricle relax, the pressure in the both the right and left ventricles will decrease rapidly. Right, that we know. So the elevated pressures in the distended large arteries that have just been filled with blood from the contracted ventricles immediately push blood back towards the ventricles, which snaps the aortic pulmonary valves closed. Okay. For another 0.03 to 0.06 second, the ventricular muscle continues to relax, even if the ventricular volume does not change, giving rise to the period of isovolumic or isometric relaxation. During this period, the interventricular pressure rapidly decreases back to their lower diastolic levels. Then the AV valves open to begin a new cycle of ventricular pumping. Okay, so why it is called a period of isovolumic relaxation is because the elevated pressures in the distended large arteries that have been just filled with blood from the contracted ventricles immediately push blood back towards the ventricles. So what happens whenever the ventricles are going to relax, the pressure which is built up in the aorta and pulmonary arteries, what will happen? It will push the blood again, try to push the blood back into the ventricles. During the time, what will happen? There will be closing of this semilunar walls. What will happen? There will be closing of the semilunar walls. That is called, which snaps the aortic and pulmonary walls closed, because here we have seen already the ventricles are getting relaxed. So once the ventricles are starting to get relaxed, what will happen? The semilunar walls which are already open will automatically close because the pressure developed in the aorta or pulmonary artery, okay, will try to push back the blood. So to prevent that, these similar walls will just close back, okay. So for another 0.03 to 0.06 second, okay, time, the ventricular muscle continues to relax even though ventricular volume does not change, giving rise to a period of isovolumic or isometric relaxation. Okay, so here what is happening, to prevent the blood flow from aorta and pulmonary artery, the relaxation phase of ventricles little bit prolonged without any flow of blood. So as there is no flow of blood either from aorta or from pulmonary arteries into the ventricles or from atria into the ventricles, but only the relaxation is occurring of about 0.03 to 0.06 second, to prevent the backflow of blood from aorta or pulmonary arteries. This phase is called a period of isovolumic relaxation. Understand? During this period, the intraventricular pressure rapidly decreases back to the lower diastolic levels. Then what will happen? Once the intraventricular pressure still more decrease, then the AV valves, tricuspid and mitral valves will open again. The blood from the diastole will rushes into the ventricle. Again the new cycle of cardiac cycle will begin. This is a continuous vicious cycle, okay. This is how the cardiac cycle is occurring in our body. Understand? So phase 4 is period of isovolumic relaxation and phase 2 is isovolumic contraction, okay. Here what is happening, here phase 2, the ventricles are contracting, but there is no flow of blood in the ventricles, so it is called contraction, isovolumic contraction, because ventricles are in a stage of ventricular contraction, but in a phase 4 ventricles are in relaxing mode. So and as they are in relaxing mode, there is no flow of blood into the ventricles, so this phase is called period of isovolumic relaxation, okay. So in a period of isovolumic relaxation, what is happening, there is no entry of blood from the aorta or pulmonary artery into the ventricles, and there is no entry of blood from the both atria into the ventricles. Understand? But in isovolumic contraction, what is happening, immediately after ventricular contraction begins, the ventricular pressure rises abruptly, causing the AV valves to close. Then additional 0.02 second is required for the ventricle to build up sufficient pressure to push the semilunar valves open against the pressure in the aorta, and therefore during this period contraction is occurring in the ventricles but no emptying occurs, okay. Here why this is occurring, to prevent the backflow of blood again from ventricle to the atria before the opening of semilunar valves. What can I repeat? I will repeat again. This contraction, isovolumic contraction, is occurring because to prevent the backflow of blood from ventricles to the atria before the opening of the semilunar walls of aorta pulmonary arteries. Understand? So this is called isovolumic contraction, okay. So cardiac cycle, 4 phases: period of filling, period of isovolumic contraction, ventricular period of ejection, and period of isovolumic relaxation. Understand? And this is blood circulation and cardiac cycle. Each cycle is initiated by spontaneous generation of action potential in SCA node. From SCA node, the action potential is traveled down from the fibers to the AV node. From the AV bundle, it is divided again and supplied to the both ventricles. So action potential takes time from SCA node to reach the AV node. This time delay is around 0.1 second. This time delay is required for For what? For contraction of atria and for relaxation of the ventricle, during which the blood will enter from atria to the relaxed ventricles. Then only the ventricles will be able to receive the blood, because ventricle should be in a relaxed mode. This occurs due to the delay in the transmission of action potential from SCA node to the AV node, because of this pathway, because of the lengthy pathway, which takes around more than 0.1 second. Okay, so this delay will help in filling of the ventricles with the blood. Okay, so this is what is cardiac cycle. I hope you all understand. If you have any doubts or comments, please send me message in the YouTube message box. Okay, thank you for listening.